So in the first part we see the calcium channel blockers physiology and their some examples. Then in the next calcium channel blockers part 2 we see the some drugs of calcium channel blockers which are most important for GPAT exam preparation. So let's start. And these calcium channel blockers causes the arterial vasodilation and decrease the tropic effect of the heart and thus causing the both decreased cardiac output and total peripheral resistance. And next we see the some calcium channel blockers in antihypertensive drugs, and the first one is Nepetipine. So this Nepetipine is a representative dihydropyridine calcium channel blocker, and various drugs can serve as alternatives. And note that this Nepetipine is a sustained release, that means prolonged release tablets are available for once daily administration. And the uses of this Nepetipine is in hypertension. This Nepetipine is used in the hypertension. Then next we see the contraindications of Nepetipine, and they are in cardiogenic shock, advanced aortic stenosis within 1 month, myocardial infarction, unstable or acute attacks of angina or and porphyria. So in these cases the Nepetipine is not used. So next we see the precautions of Nepetipine. In that, if ischemic pain occurs or existing pain worsens the shortly after starting treatment, and also in poor cardiac reserve, heart failure or significantly impaired left ventricular function, and reduced dose in hepatic impairment, diabetes mellitus, may inhibit labor, pregnancy, breastfeeding, and avoid grapefruit juice. This may affect the metabolism. So these are the precautions of Nepetipine. Next we see the dosage of Nepetipine. So in hypertension by mouth as sustained release tablets, adult usual range is 20 to 100 mg daily in 1 to 2 divided doses according to the manufacturer's direction. And note that the prescribers should be aware that different formulations of sustained release tablets may not have the same clinical effects. If possible, the patients should be maintained on the same brand. Short-acting formulations of Nepetipine should be avoided in hypertension, and particularly in those patients who also have angina, since their use may be associated with large variations in blood pressure and reflex tachycardia, and also in possibly leading to myocardial or cerebrovascular ischemia. So next we see the some adverse effects of Nepetipine, and the adverse effects are headache, flushing, dizziness, lethargy, tachycardia, palpitations, gravitational edema. That this gravitational edema is only partly responsive to the diuretics, and also rashes, erythema multiform reported, and pruritus, urticaria, nausea, constipation of or diarrhea, urticaria, increased frequency of micturition, eye pain, visual disturbances, gum hyperplasia, paranesthesia, myalgia, tremors, impotence, gynecomastia, depression, and cholestasis, and jaundice, and cholangiostasis are the adverse effects of Nepetipine. So next we see the organic nitrates. These organic nitrates causes both arterial and venous vasodilation, thus it decreases the total peripheral resistance. So these organic nitrates causes both arterial venous vasodilation, thus decreases the total peripheral resistance. And this organic nitrates we see in the anginals. So next one is alpha 2 adrenergic receptor agonist. This is centrally acting antihypertensives. So these alpha 2 adrenergic receptor agonists which act centrally in antihypertensives. So we see the mechanism of this alpha 2 adrenergic receptor agonists. So these alpha 2 adrenergic receptor agonists inhibit the sympathetic vasomotor centers in the brainstem and in the sympathetic and parasympathetic ganglia, thus causing the vasodilation and following decrease the total peripheral resistance. And these drugs stimulate the central alpha 2 adrenergic receptors in rostral ventrolateral medulla, which control the sympathetic outflow, and the resulting decreases in the central sympathetic tone leads to a fall in both cardiac output and peripheral vascular resistance. And the drugs causes the sedation, dry mouth and fluid retention, and methyl dopa requires conversion to alpha methyl norepinephrine, and clonidine does not require to conversion. So we first see the methyl dopa. This is available in tablets. Methyl dopa 250 mg, and this methyl dopa is used in hypertension in pregnancy. So in the GPAT there is a question, which drug is used in hypertension in pregnancy, and the right answer is methyl dopa. So next we see the contraindications of this methyl dopa. This methyl dopa is contraindicated in depression, active liver disease, porphyria and phacochromocytoma. So these are the contraindications of methyl dopa. So next we see the precautions of methyl dopa in history of hepatic impairment, renal impairment, blood counts and liver function test, advice history of depression, and positive direct comb test in up to 20% of patients. This affects the blood cross matching and also the interference with laboratory tests, pregnancy and breastfeeding in appendices 2 and 3. And the skill tasks are the may impair the ability to perform the skill task, for example operating machinery or and driving. So next we see the some dosage of methyl dopa. So this methyl dopa is used in hypertension in pregnancy, and dosage is by mouth, that means by oral route of administration, and in adult the dose is initially 250 milligram, and this dose takes 2 to 3 times daily, and if necessary gradually increase at intervals of 2 or more days, maximum 3 gram daily. So next we see some adverse effects of methyl dopa, and the adverse effect includes the sedation, dizziness, lightheadedness, postural hypotension, weakness, fatigue, headache, fluid retention and edema, sexual dysfunction, impaired concentration and memory loss. And next we see the alpha 1 adrenergic receptor antagonists. So these alpha 1 adrenergic receptor antagonist causes the vasodilation, thus decreasing the total peripheral resistance. And the alpha 1 adrenoreceptor blockers produce the vasodilation by blocking the action of norepinephrine at postsynaptic alpha 2 receptors in arteries and veins, and these results in a fall in peripheral resistance without a compensatory rise in a cardiac output. So these alpha 1 adrenoreceptors are blocking the action of norepinephrine at postsynaptic alpha 2 receptors in arteries and veins. That means in both arteries and veins, these alpha 1 receptors is produced and they block by the action of norepinephrine, and this results in fall in peripheral resistance without a compensatory rise in cardiac output. And doxazocin, terazocin and less commonly prazosin are used as oral agents in the treatment of hypertension. These are relatively more selective for alpha 2 and alpha 1 receptors which are involved in vascular smooth muscle contractions. And also alfuzosin, tamsulosin are used for symptomatic treatment of benign prostatic hyperplasia, that means BPH. Since compared to other oral alpha 2 blockers, they have less antihypertensive effects and they are relatively more sedative as antagonists at the alpha 2 subtype, the primary subtype located in the prostate gland. And this is based on Alahart study data. Alpha blockers are not long considered first line drugs for the treatment of hypertension. They are the drug of choice for the treatment of hypertensive patients with benign prostatic hyperplasia, that means BPH, and the adverse effects include the first dose hypotension, dizziness, lethargy, fatigue, palpitations, syncope and peripheral edema and unconsciousness. And next we see the beta 1 adrenergic receptor antagonists, and this beta 1 adrenergic receptor antagonist decreases the sympathetic action on the heart, thus decreasing the cardiac outputs. And the beta 1 adrenergic receptor antagonist is atenolol. So this atenolol is a representative beta adrenoreceptor antagonist, and these various drugs can serve as alternatives. And this atenolol is available in tablets, atenolol 50 mg and 100 mg. Next we see the uses of atenolol. Atenolol is used in hypertension, angina, arrhythmias and migraine prophylaxis. So next we see the contraindications of this beta 1 adrenergic receptor antagonist atenolol. Contraindications of atenolol includes the asthma or history of obstructive airway diseases. This unless no alternative, then with extreme cautions and under specialist supervision. And also the uncontrolled heart failure, Prinzmetal angina, marked bradycardia, hypotension, sick sinus syndrome, second or third degree atrioventricular block, cardiogenic shock, metabolic acidosis. So metabolic acidosis is the contraindications of atenolol, and also severe peripheral arterial diseases, phacochromatoscytoma. So this phacochromocytoma is the major contraindications of atenolol. This phacochromocytoma is unless used with alpha blocker. So next we see the some precautions of atenolol. The precautions include these atenolol is avoid abrupt withdrawal, especially in angina, may precipitate or worsen heart failure, pregnancy, breastfeeding, first degree of atrioventricular block, liver function deteriorates in portal hypertension, reduced dose in renal impairment, diabetes mellitus, and small decrease in glucose tolerance, masking of symptoms of hypoglycemia, history of hypersensitivity, decreased reaction to allergens, also reduce the response to epinephrine. This epinephrine is adrenaline, and also in myasthenia gravis. So these are the precautions of atenolol. So next we see the dosage of atenolol. The dosage, this we know that this atenolol is used in hypertension and dosage is by mouth, and in adult 50 mg once daily, and the higher dosage rarely unnecessary. So next we see the adverse effects of atenolol, and these adverse effects include gastrointestinal disturbances, fatigue, cold hands and feet, exacerbation of intermittent claudications and Raynaud's phenomenon. So this Raynaud's phenomenon is the famous adverse effect of atenolol, and also bronchospasm, bradycardia, heart failure, dry eyes and oculomucocutaneous syndrome is reversible on withdrawal. So at last we see the drugs acting on the renin-angiotensin-aldosterone system in antihypertensive drugs, and these drugs causes the vasodilation and decrease the blood volume, and thus decreasing the total peripheral resistance. And the drugs like Inelapril is used in antihypertensives. So this Inelapril is a representative angiotensin converting enzyme, that means ACE inhibitor, and these various drugs can serve as alternatives, and this Inelapril is used in hypertension and heart failure, and the contraindications of Inelapril are in hypersensitivity to ACE inhibitors including angioedema, renovascular diseases and pregnancy. This hypersensitivity to ACE inhibitors, pregnancy and renovascular diseases are the contraindications of Inelapril. So next we see the precautions of Inelapril. In that they use with diuretics, hypotension with first dosage, especially in patients on diuretics, on a low sodium diet, on dialysis if dehydrated, or with heart failure, peripheral vascular diseases or generalized atherosclerosis. In atherosclerosis there is a risk of clinically silent renovascular disease, and also used with great care in severe or symptomatic aortic stenosis, and monitor that renal function before and during the treatment, and also the renal impairment. This reduces the dose, and also liver impairment, renal impairment possibly increase risk of agranulocytosis in collagen vascular diseases, and history of idiopathic or hereditary angioedema. In this hereditary angioedema, the dose is used with care or should be avoided, and also in breastfeeding. So these are the precautions of Inelapril. So next we see some uses with diuretics of Inelapril. So when Inelapril is used with diuretics, then there is a risk of very rapid falls in blood pressure in volume depleted patients. Treatment should be therefore be initiated with very low dosage. High dose diuretics therapy, that means furosemide dosage greater than 80 mg should be discontinued or dose significantly reduced at least 24 hours before starting the Inelapril, and this Inelapril may not be possible in heart failure due to risk of pulmonary edema, and if high dose diuretic cannot be stopped, and in medical supervision advice for at least 2 hours after administration or until the blood pressure is stable. So next we see some anaphylactoid reactions of Inelapril, and anaphylactic reactions like in these avoid Inelapril during dialysis with high flux polyacrylonitrile membranes, and during low density lipoproteins apheresis with dextran sulfate, and also withhold before desensitization with wasp or bee venom. So next we see the dosage of Inelapril, and we know that this Inelapril is used in hypertension, and the doses are taken by mouth, that means by oral route of administration, and the dose is initially 5 mg once daily, and this dose is used in addition to diuretics. And in elderly patients or in renal impairments, initially 2.5 mg daily dose is given, and usual maintenance of dose is 10 to 20 mg once daily, and in severe hypertension may be increased to maximum 40 milligram once a daily. So at last we see the some side effects, that means adverse effects of enalapril. These includes dizziness, headache, muscle cramps, rashes and renal impairment. Rarely Stevens-Johnson syndrome. So this Stevens-Johnson syndrome is the major adverse effect of enalapril. So there is a question in GPAT. The which drugs adverse effects is Stevens-Johnson syndrome, and the answer is enalapril. And the reverse question is asked, the drug in adverse effects of enalapril is, and the right answer is Stevens-Johnson syndrome. And also the toxic epidermal necrolysis, exfoliative dermatitis and pemphigus. These are the side effects of enalapril, and in this way we completed the calcium channel blockers in antihypertensive drugs. So in this calcium channel blockers we see the some physiology of calcium channel blockers. Then next we see the some drugs of calcium channel blockers like Nepetipine and the organic nitrates and alpha 2 adrenergic receptor agonists, in that Methyl Dopa, and the alpha 1 adrenergic receptor agonist, in that we see the doxazocine, terazocine, less commonly used trazocine, and the alpuzocine and tamsulosin. And at last we see the beta 1 adrenergic receptor antagonist, and this example is Atenelol. And at last we see the drugs acting on renin, angiotensin, aldosterone system in antihypertensive drugs, and the example is enalapril. So in that way this calcium channel blockers is completed, and in the next antihypertensive drugs we see the some diuretics used as antihypertensive drugs. So hope you like this video, calcium channel blockers used in antihypertensive drugs. So hope you like this video. Please, if you like this video, please comment on comment section, and please share this video to more and more to your GPAT aspirants as well as CET aspirants, and like, share and subscribe to our channel. And thanks for watching this video. Thank you for watching. Stay connected with Pharma Extract. Stay tuned. So in the first part we see the calcium channel